Fellow Ghanaians, good evening. Today, Sunday, 19th April, is exactly 3 weeks since I came to you and announced the imposition of restrictions to movement in the Greater Accra Metropolitan Area and Kaswa, and the Greater Kumasi Metropolitan Area and its contiguous districts. I explained at the time that the decision was taken to give government the opportunity to try to contain the spread of the virus, scale up effectively the tracing of persons who had come into contact with infected persons, test them for the virus, and if necessary, quarantine and isolate them for treatment, should they prove to be positive for the virus. The decision to restrict movement has occasioned a number of severe difficulties for all of us across the country, especially for the poor and vulnerable, and not only for those resident in the affected areas. Let me express my gratitude to all of you for bearing with government, all health workers, and with members of our security services throughout this period. I requested all of us to sacrifice for our collective good, and we have been doing just that. I thank all our healthcare workers, the men and women of our security services, and members of the media for the work they've been doing in helping to combat the spread of the virus. Let me also thank the individuals and organizations who have made contributions to COVID-19 National Trust Fund. It is truly appreciated. Fellow Ghanaians, since the first 2 cases of infections were recorded on our shores, we have to date traced some 86,000 contacts, out of which we have test results of 68,591 contacts. There is thus a backlog of some 18,000 tests whose results are yet to be received. The overwhelming majority of these contacts have been established in the last 3 weeks of the partial lockdown in Accra and Kumasi. Out of this number, 1,042 persons, i.e. 1.5%, have been confirmed as positive, with 67,549, i.e. 98.5%, testing negative. 99 persons have recovered and have been discharged, and 930 persons who have been isolated are responding to treatment either in their homes or in treatment facilities. These 930 persons, after their treatment, will soon undergo the mandatory 2 tests to determine if they have also recovered from the virus or otherwise. The main reason our country has seen an increase in the number of confirmed cases over the last 3 weeks is because of the decision we took aggressively to trace and test contacts of infected persons. This has enabled us to identify and isolate infected persons, protect the population from further infections, and contain better the spread of the virus. Indeed, Ghana is the only other country in Africa to have conducted more than 60,000 tests, and we are ranked number 1 in Africa in administering of tests per million people. The decision to impose restrictions on movement was backed by the data at hand, and our next course of action, again, is backed by data and by science. Indeed, all that government is doing is intended to achieve 5 key objectives: limit and stop the importation of the virus, contain its spread, provide adequate care for the sick, limit the impact of the virus on social and economic life, and inspire the expansion of our domestic capability and deepen our self-reliance. It is important to state at the very outset that scientists at the University of Ghana have successfully sequenced genomes of the virus responsible for the COVID-19 pandemic. obtaining important information about the genetic composition of viral strains in 15 of the confirmed cases in Ghana. This is a significant milestone in Ghana's response to the pandemic, as it will strengthen surveillance for tracking mutations of the virus and in the tracing of the sources of community infections in people with no known contact with confirmed cases. The Ghanaian scientific community is to be warmly applauded for this advance and contribution to global knowledge. Their work makes us proud to be Ghanaians, and who knows, God may work through them to discover a vaccine. What a triumph that would be. Indeed, the recent genomic characterization of African coronaviruses by our own scientists illustrates the need to establish the enabling framework for sustaining vaccine manufacturing in Africa. We must advance African-led partnerships to drive scientific innovations for the control of viral diseases by vaccination. Ghana, recognizing this critical public health tool, will support the African Vaccine Manufacturing Initiative, which is chaired by Noguchi's Professor William Ampofo, to promote the agenda for vaccine development and manufacturing in Africa by Africans for the world. Government has also introduced the use of drones to expedite the transportation of samples to laboratory centers. On Friday, 17th April, for example, 51 samples were delivered from the Ominako Drone Distribution Center to Noguchi. Furthermore, we're introducing rapid results testing to augment our surveillance and enhance contact tracing efforts so that we can quickly isolate and treat confirmed cases. From the 68,591 samples tested, we've been able to understand better the dynamism of the virus, mapped out its geographic footprint, and established current and potential hotspots. We've also been able to isolate and educate asymptomatic carriers and thereby help minimize the spread of the virus. So far, it has been established that the virus was imported into our midst from foreign shores and is being spread through person-to-person contact. The majority of persons infected in Ghana have mild to no symptoms at all, whilst a very small number have required hospital treatment.
YenMotion.com
with underlying ailments have died. Towards treatment, we've expanded and added to our network of COVID-19 treatment centers, with the Ghana East and Bank of Ghana hospitals being 100% dedicated to the fight. In addition, we have set aside separate COVID-19 treatment centers at the University of Ghana Medical School, Hospital, the Kolebu Teaching Hospital, Akuffo Addo Teaching Hospital, Kumasi South Hospital, and in other designated regional and district hospitals. Last Friday, I was honored to do the virtual sod-cutting ceremony for the construction of a 100-bed infectious disease and isolation facility at the Ghana East Municipal Hospital, which is being funded through a public-private partnership under the leadership of the Ghana COVID-19 Private Sector Fund, and whose construction, with the assistance of the 48th Engineer Regiment of the Ghana Armed Forces, will be completed in 6 weeks. Members of the Private Sector Fund have indeed acted like citizens and not spectators in these testing times for our country, and their patriotism is to be loudly praised. We have also scaled up the domestic production of personal protective equipment, and our health care facilities so far have taken delivery of 14,550 scrubs, 11,900 gowns, 19,980 head covers, 263,281 nose masks, 13,002 N95 nose masks, 41,117 varying sizes of sanitizers have also been produced locally and delivered to our health facilities. The enhancement of our capacity to test has been made possible by the dedication of the expanded teams at Noguchi Memorial Institute for Medical Research, the Kumasi Center for Collaborative Research, and the National Public Health Reference Laboratory. Further, we're making significant investments in the laboratories of the Veterinary Laboratory, Accra, the Center for Scientific and Industrial Research Laboratory in Accra, the Police Hospital, the 37 Military Hospital, the University of Health and Allied Sciences in Ho, the Veterinary Services Department in Sekondi Takoradi, the Public Health Laboratory in Tamale, the War Memorial Hospital in Navrongo, and the Cape Coast Teaching Hospital, so they can also use PCR technology. We are recalibrating 100 regional and district tuberculosis gene expert laboratories across the country to help ensure that we have a minimum situation of one testing center per region. Fellow Ghanaians, in view of our ability to undertake aggressive contact tracing of infected persons, the enhancement of our capacity to test, the expansion in the numbers of our treatment and isolation centers, our better understanding of the dynamism of the virus, the ramping up of our domestic capacity to produce our own personal protective equipment, sanitizers, and medicine, the modest successes chalked in containing the spread of the virus in Accra and Kumasi, and the severe impact on the poor and vulnerable. I've taken the decision to lift the 3-week-old restriction on movements in the Greater Accra metropolitan area and Kaswa, and the Greater Kumasi metropolitan area and its contiguous districts, with effect from 1 a.m. on Monday, 20th April. In effect, tomorrow, we'll see the partial lockdown in Accra and Kumasi being lifted. I must make it clear at the outset that lifting these restrictions does not mean
yenmotion.com.
All other measures are still firmly in place. For the avoidance of doubt, the earlier measures announced on Wednesday, 15th March, which have been extended, are still very much in force and have not been relaxed. I'm demanding even greater adherence to these measures. In here, I'm referring to the suspension of all public gatherings, including conferences, workshops, funerals, parties, nightclubs, drinking spots, beaches, festivals, political rallies, religious activities, and sporting events. All educational facilities, private and public, are to remain closed. Businesses and other workplaces can continue to operate, observing staff management and workplace protocols with a view to achieving social distancing and hygiene protocols. Operators of public transport, including our buses, trotros, and taxis, are to continue to run with a minimum number of passengers, as they have been doing for the last 3 weeks, in maintaining social distancing. They must also continue to ensure the maintenance of enhanced hygienic conditions in all vehicles and terminals by providing, amongst others, hand sanitizers, running water, and soap for washing of hands. Domestic airlines are required to adhere to the same protocols. The Ministry of Local Government and Rural Development, together with metropolitan, municipal, and district assemblies, will continue to implement measures to enhance conditions of hygiene in markets across the country and expand the policy of alternate days for alternative products to improve social distancing in all markets. As has been established, the overwhelming majority of confirmed cases have come from travelers or from people who have come into contact with travelers. It is therefore incumbent on us to continue to be vigilant about travelers into our country until further notice, and to congratulate the men and women of the Immigration Service and the Marine Police Unit for their work in securing our borders. The arrest of 10 West African nationals in Tamale, who all tested positive for the virus. The arrest of the 6 Nigerian travelers who entered Ghana through unapproved routes along the Ghana-Togo border near Aflao, who also tested positive for the virus. And the recent arrest of 10 fishermen in the Western region who returned from Côte d'Ivoire and have been quarantined testify to the